Bob, let's transition to you. I mean, you're the chief clinical integration officer of a health system with multiple hospitals. You're the CEO of a large physician practice that supports those hospitals. I want to guess, though, that, I mean, you're a physician. And so I'm thinking that you bring a perspective on physicians first, and that influences how you lead a team of physicians, and it influences how you go about your work at the health system level. I'd love for you to just talk about your two roles and how you approach that and just sort of what ultimately it's your responsibility to accomplish.
Yeah, I mean, specifically, I sort of laugh at my boss when he tried to come up with the longest title he could come up with, Chief Clinical Integration Officer, because I lobbied for Chief Clinical Officer, and they thought that integration part was so important, and it ended up really being important. What we saw as an organization, the larger St. Elizabeth, was at St. Elizabeth Healthcare, our hospital side of the organization, and our St. Elizabeth Physicians Group were not growing together; they were actually growing apart. And as those two organizations were sort of growing apart, it was also splintering our independent medical staff because it felt like the competition was tough between the employed and the independent groups, and it spread. It goes down the path to nursing or other administrative folks within the organization. And so when I was asked to take this new job, um, the least important word in the title ended up being the most important part of the title, and that was integration. And how do I get these folks to end up coming back together and work together?
Mm.
And I think for me, the key has always been respect. And I try to honor all physicians, no matter their role, their relationship to the organization, or even outside the organization. Is that I think I do understand what many of them went through to get. And I'm not a surgeon, and so I didn't go through the same training a surgeon did, or I'm not a gastroenterologist. I'm a family doc, but I think we have a basic understanding of what all of us went through to sort of get to where we are. And so I try to always honor that and try to respect that and try to make sure my other colleagues in leadership understand and respect that. And so I think that's sort of the key of what I was asked to do when I took this new role on about 6 years ago.
Mm. Do you find yourself switching hats from day to day, or is it kind of one hat, the
Well,
system role versus the CEO role?
at this stage, it's sort of become one hat for me, but I think that I say this all the time that a physician leader um, always seems to have to straddle the fence between the organization and the physician group, the hospital organization, the physician group, and probably if you're doing a good job, all of them probably think you're a little bit of a pain in the tail end because you're trying to bring both groups along together, and their individual um, goals may not always be completely aligned. And so, how do you do that? So, I think that I've been doing this long enough and on the leadership side now for 22 years, 23 years, that it feels more like the same hat all the time. But
Mm.
it does get a little frustrating at times when I'll say one side of the street doesn't understand what's going on the other side of the street.